What causes tinnitus? Tinnitus can arise in any of the following areas: the outer ear, the middle ear, the inner ear, or by abnormalities in the brain. Some tinnitus or head noise is normal. If one goes into a soundproof booth and normal outside noise is diminished, one becomes aware of these normal sounds. We are usually not aware of these normal body sounds because outside noise masks them. Anything such as earwax or a foreign body in the external ear that blocks these background sounds will cause us to be more aware of our own head sounds. Fluid, infection, or disease in the middle ear bones or eardrum or tympanic membrane can also cause tinnitus. One of the most common causes of tinnitus is damage to the microscopic endings of the hearing nerve in the inner ear. Advancing age is generally accompanied by a certain amount of hearing nerve impairment and consequently chronic tinnitus. Today, loud noise exposure is a very common cause of tinnitus, and it often damages hearing as well. Unfortunately, many people are unconcerned about the harmful effects of excessively loud noise, firearms, and high-intensity music. Some medications, for example aspirin, and other diseases of the inner ear, such as Meniere's syndrome, can cause tinnitus. Tinnitus can in very rare situations be a symptom of such serious problems as a brain aneurysm or a brain tumor or acoustic tumor. Tinnitus facts. Tinnitus can arise in any of the four sections of the ear: the outer ear, the middle ear, the inner ear, and the brain. Tinnitus is abnormal ear noise. Measures can be taken to lessen the intensity of tinnitus. Persisting unexplained tinnitus is evaluated with a hearing test or audiogram. Can tinnitus be prevented? Do not place objects in your ear such as cotton swabs or Q-tips to clean your ear. This can cause a wax impaction against your eardrum which can cause tinnitus. Take blood pressure medicines and other prescribed medications as they are ordered by a doctor. According to the American Tinnitus Association, there are several things you can do to protect yourself from excessive noise-related tinnitus. When around any noise that bothers your ears, such as a concert, sporting event, or hunting, wear hearing protection or reduce noise levels. Even everyday noises such as blow-drying your hair or using a lawnmower can require protection. Keep earplugs or earmuffs handy for these activities. Protect your hearing at work. Your workplace should follow Occupational Safety and Health Administration regulations. Wear earplugs or earmuffs and follow hearing conservation guidelines set by your employer. How is tinnitus evaluated? A medical history, physical examination, and a series of special tests can help determine precisely where the tinnitus is originating. It is helpful for the doctor to know if the tinnitus is constant, intermittent, or pulsating, synchronous with a heartbeat, referred to as pulsatile tinnitus, or is it associated with hearing loss or loss of balance or vertigo. All patients with persisting unexplained tinnitus need a hearing test or audiogram. Patterns of hearing loss may lead the doctor to a diagnosis. Other tests, such as the Auditory Brainstem Response or ABR, a computerized test of the hearing nerves and brain pathways, computer tomography scan or CT scan, or magnetic resonance imaging or MRI scan may be needed to rule out a tumor occurring on the hearing or balance nerve. These tumors are rare, but they can cause tinnitus. What is and what are the symptoms of tinnitus? Tinnitus is a ringing, swishing, or other type of noise that seems to originate in the ear or head. In many cases, it is not a serious problem, but rather a nuisance that eventually resolves. Rarely, however, tinnitus can represent a serious health condition. It is not a single disease, but a symptom of an underlying condition. Nearly 36 million Americans suffer from this disorder. In almost all cases, only the patient can hear the noise. What are tinnitus relief remedies? Some common and easy remedies such as the following may be of benefit to some individuals. Some tinnitus patients have been found to have lower zinc levels and may benefit from zinc supplementation. There are some behavioral and cognitive therapies that have been successful in treating tinnitus. Seeking out a multidisciplinary program at a tinnitus center may improve chances of successful treatment. The types of therapies include tinnitus retraining therapy, masking, and behavioral therapy. Ginkgo biloba has been touted as a natural tinnitus remedy, but controlled studies to date have not shown it to be effective. Reducing or avoiding caffeine and salt intake and quitting smoking may help relieve tinnitus symptoms. One study showed melatonin may help tinnitus sufferers, particularly those with disturbed sleep due to the tinnitus. However, this has not yet been verified in controlled studies. Is there anything to do to lessen intensity of the tinnitus? It is important to realize that the hearing system is one of the most delicate and sensitive mechanisms in the body. Since it is a part of the general nervous system, it is sensitive, to some degree, by anything that affects the overall health of the individual, both physical and psychological. Therefore, in order to lessen the intensity of tinnitus, it is advisable to make every effort to try to stop worrying about the tinnitus. Often, the more you worry and concentrate on the noise, the louder it will become. Avoid exposure to loud sounds and noises. Exercise. Decrease salt intake. Get adequate rest and avoid fatigue. Avoid aspirin or aspirin products in large quantities. Reduce anxiety. Avoid nerve stimulants such as coffee and colas or caffeine and tobacco or nicotine. Control blood pressure. Utilize masking noise. Tinnitus is usually more bothersome when the surroundings are quiet, especially when you are in bed. A competing sound such as a ticking clock, a radio, a fan, or white noise machine may help mask tinnitus. Small hearing aid-like devices which generate a competitive sound may help reduce the awareness of the tinnitus. Biofeedback may help or diminish tinnitus in some patients. Tinnitus medications. In many cases, there is no specific treatment for tinnitus. It may simply go away on its own, or it may be a permanent disability that the patient will have to live with. Some otolaryngologists or ear specialists have recommended niacin to treat tinnitus. However, there is no scientific evidence to suggest that niacin helps reduce tinnitus, and it may cause problems with skin flushing. The drug gabapentin, like Neurontin or Gabaron, was studied in high doses and reduced the annoyance level of the tinnitus in some patients, but did not decrease the volume of the noise, and was not found to be better than placebo. A 2005 study in Brazil using acamprosate or Camprol, a drug used to treat alcoholism, showed a nearly 87% rate of relief of symptoms. Studies of this drug for treatment of tinnitus are currently ongoing in the United States. What is the treatment of tinnitus? After a careful evaluation, your doctor may find an identifiable cause and be able to treat or make recommendations to treat the tinnitus. Once you have had a thorough evaluation, an essential part of treatment is your own understanding of the tinnitus, what has caused it, the person's specific symptoms, and options for treatment.